The stage of a tumor describes how far the disease has spread. The 2023 Figo staging system for endometrial cancer, like the 2009 edition, has 4 main stages, stage 1 to stage 4. As the stage number increases, the disease becomes more advanced. Each stage is further divided into A, B, and C, with disease severity increasing from A to C. Unlike the earlier staging, which focused only on anatomy, the 2023 system also includes other prognostic factors, such as the histologic type of the tumor grade, lymphovascular space invasion, and molecular testing. Histopathological findings are central features of the 2023 revision of the Figo staging of endometrial carcinoma. All endometrial carcinomas are classified into their respective histologic types according to the 5th edition of WHO classification of tumors. Remember the histological types using the mnemonic mucose. M stands for mixed cell carcinoma. U is undifferentiated carcinoma. C represents clear cell carcinoma and carcinosarcoma. O includes other rare types, such as mesonephric-like carcinoma and gastrointestinal mucinous-type carcinoma. S stands for serous carcinoma, and E is endometrioid, endometrial carcinoma. Tumor grade reflects how differentiated the cells are. Tumors are classified as low-grade or high-grade based on how they look histologically. Low-grade tumors are well differentiated. Their cells look more like normal tissue, and they tend to grow slowly. They're usually less aggressive, have a better prognosis, and are less likely to spread early. High-grade tumors are poorly differentiated. Their cells look very abnormal and tend to grow rapidly. They're more aggressive, more likely to invade surrounding tissues, and have a higher risk of metastasis. In endometrial cancer, all histological types are considered high-grade by definition, except grade 1 and grade 2 endometrioid carcinoma. Endometrioid carcinoma is graded based on architectural features, especially the percentage of solid, non-glandular growth. Grade 1 has up to 5% solid growth, grade 2 has 6 to 50%, grade 3 has 50% or more. If the nuclear atypia is inappropriately high for the architectural grade, the grade is increased by 1. Again, apart from grade 1 and grade 2 endometrioid carcinoma, which are considered low-grade, all other histologic types are aggressive tumors. Molecular subtyping in endometrial cancer staging helps to predict prognosis, refine risk stratification, and guide treatment decisions. Endometrial carcinoma can be classified into 4 molecular groups based on the Cancer Genome Atlas findings. Remember the 4 molecular groups using the mnemonic, please note my prognosis. First P for POL mutated, N for no specific molecular profile, M for mismatch repair deficient, second P for P53 abnormal. POL mutated tumors are associated with the best prognosis. Mismatch repair deficient and no specific molecular profile are associated with intermediate prognosis, while P53 abnormal is associated with poor prognosis. Lymphovascular space invasion, or LVSI, refers to the presence of tumor cells within lymphatic channels and/or blood vessels adjacent to the primary tumor. Lymphovascular space invasion is further described as focal when it has limited involvement of a few vessels, substantial or extensive LVSI when there's involvement of multiple vessels. Substantial LVSI carries a significantly worse prognosis than focal LVSI. Remember the stages of endometrial carcinoma using the mnemonic, conniving Clark loves baddies. Stage 1 disease is confined to the uterus, and in selected low-grade cases may also involve the ovary. The con in conniving is for stage 1 disease. Stage 1, like all the others, is further divided into A, B, and C. Remember the details of these substages using the mnemonic English, loud, and aggressive. In stage 1A, the disease is limited to the endometrium or a polyp. Non-aggressive histologic types involving less than half of the myometrium, with no or focal lymphovascular space invasion, or a good prognosis disease. Stage 1B involves low-grade tumors invading half or more of the myometrium, with no or focal lymphovascular space invasion. Stage 1C refers to aggressive histologic types limited to a polyp or the endometrium. Stage 2 disease involves cervical stromal invasion in stage 2A, substantial lymphovascular space invasion in stage 2B, and an aggressive histologic type with any myometrial invasion in stage 2C. Clark in Conniving Clark Loves Baddies helps you remember stage 2 disease. Stage 3 indicates local and/or regional spread of the tumor of any histologic subtype. Loves for local or regional spread. Again, remember, all stages have A, B, and C substages. In stage 3A, the disease involves the uterine serosa, ovaries, or fallopian tubes. Think sofa, but not that far. The disease is still local. In stage 3A1, there's spread to ovary or fallopian tube. In stage 3A2, there's involvement of the uterine serosa. In stage 3B, there's spread to the vagina and/or parametria, or pelvic peritoneum. Think viper. A deadly viper spreading its venom to the vagina and/or parametria, or pelvic peritoneum. In stage 3C, there's spread to pelvic or para-aortic lymph nodes. This may be classified as micrometastasis or macrometastasis. In stage 4, things get really bad. Stage 4 represents advanced disease. In stage 4A, there's invasion of the bladder and/or bowel mucosa. The B in baddies is for bladder and/or bowel mucosa. In stage 4B, there's abdominal peritoneal metastasis beyond the pelvis. A in baddies is for abdominal peritoneal spread. Finally, in stage 4C, there's distant metastasis, including metastasis to any extra or intra-abdominal lymph nodes above the renal vessels, lungs, liver, brain, or bone. Always remember Conniving Clark loves baddies when you think about endometrial staging. If you found this video helpful, please like and share it with colleagues. Subscribe to the channel and turn on notifications to stay updated on future medical content. Until then, stay safe.